Hello, I'm Bobby Watts, the Director of the National Institute for Medical Respite Care, which I will call NIMRC for short, and the CEO of the National Healthcare for the Homeless Council, which I'll just refer to as the Council. Healthcare for the Homeless programs have been operating medical respite, or also known as recuperative care programs, for more than 30 years. And for 20 years, the Council has been the host of the Respite Care Providers Network. The Respite Care Providers Network is a network that consists of over 1,500 individuals that operate, work in, or have been served by medical respite programs. There are approximately 100 around the country, and this is undoubtedly the greatest source of information and knowledge about medical respite. So after 30 years of Healthcare for the Homeless programs operating medical respite and 20 years of the Council being the host of the Providers Network, why are we choosing this moment to launch our special initiative of NIMRC? The answer has to do with the moment that we are in. The COVID-19 pandemic has made many communities aware, some for the first time, of the importance of addressing the needs of their neighbors without homes. And they realize that they are ill-equipped to meet the health needs. They also realize that medical respite is an excellent model for doing that. I'm reminded of a colleague in North Carolina who said for years she's been having limited success in engaging her local health system. And in the last few months, they are contacting her, chasing her down, trying to learn more and get more medical respite services. What many communities have done to say, how can we help meet the needs of people without homes? How can we keep them safe? Many of them have set up what are called alternative care sites, or ACSs, as a way for people who in shelters to be able to move to a place where they are safe. And also people from encampments. Sometimes these ACSs are in part of a convention center or arena. Sometimes they are placing people in individual motel rooms. These ACSs have the same goal as medical respite, to meet the needs of people who do not need to be in a hospital, but are too sick to be in a shelter, on a friend's couch, or on the street. This has further elevated the profile of medical respite, and the Council has been receiving many more inquiries from people around the country saying, can you help us start medical respite programs? They want to learn more about it. Another reason why we have chosen this moment is that this is a time when we are all seeing a major uprising or a rising up for social justice following the death, the murder of George Floyd, in a long series of murders. What the Council for the last 3 years has placed racial equity at the center of our work, or working hard to do that, so that it's part of all that we have done. Really, everyone in the healthcare system would say that's commendable, but not everyone had the will to make sure that these principles of racial justice and racial equity are really incorporated in their programs. But now many, many more are willing and see the need. So we see this as an important time for the Council to advance medical respite in a way that also helps to build equity into the healthcare system, into the homeless response system, into our housing system. Thank you for your understanding and your support of understanding that why now is the time to work to promote and expand and build on the promise of medical respite to save lives, to improve health, to build a better world, and to end homelessness. Thank you very much.